Emily Cleveland Job. I'm the naturopathic doctor here at Knox Wellness. Sorry for the delay. This talk was supposed to be at 4:30, but I was running a little late today. So thanks for joining us. I decided to do this talk on chronic fatigue, and Emily Kopek and I were kind of giggling because it's such a huge subject and kind of a difficult subject. So hopefully I will give you some good information and some good places to start. And if you have any questions, feel free to just call the clinic. You can always set up a free phone consultation. And if you're an existing patient, you can always talk to us about any questions you have. So I thought I would kind of go over the diagnosis for chronic fatigue, because I think a lot of times it's a diagnosis that sounds just like it's describing symptoms, and that there's not a lot of known causes, but there are. So I'm combining the diagnostic criteria from the CDC and the Institute of Medicine. So the CDC says that you have to have all three of the following. First is substantial impairment in your general functioning for your occupation, your social aspects, and your just energy or exertional levels. So substantial impairment for more than 6 months that comes with some profound fatigue and has a definite onset, meaning you didn't suffer from this from childhood or for all of your life, but there was kind of a marked time that this started. The next is that you'll have some post-exertional malaise, and this could even be going out and walking for 5 minutes can cause you to be exhausted for days. And then unrefreshing sleep. Then the CDC says you have to have one of the following. This would be cognitive impairment or orthostatic dysfunction, meaning a blood pressure problem, generally being too low of blood pressure. So the CDC adds in, we're getting a little reverb, sorry. The CDC adds in that you might have muscle pain, joint pain, and generally the joint pain is going to be joint pain that's been worked up for other things like osteoarthritis, rheumatoid arthritis, something like that, that really has no cause. Not going to have any joint effusions or anything like that, but just migrating joint pain. Headache, you might have some cervical or axillary or armpit lymphadenopathy, so swelling of lymph nodes, pharyngitis, and then 2/3 of people with chronic fatigue will also have some anxiety and depression. And basically this tends to be something that comes after an illness. So the kind of more detailed diagnosis, or what they use as the ICD-10 code, is usually called post-viral fatigue. And the Mayo Clinic actually wants to call this systemic exercise or exertional intolerance. Generally, females will have this more than males, although males do get it. And generally, you look very healthy. And so a lot of times, your blood work will look normal, your physical exam will be normal, but you still have this kind of debilitating condition. And a lot of times practitioners will accuse these patients of being malingering patients because they seem otherwise healthy, but they're fairly non-functional. A lot of patients end up on disability because of this condition. The symptoms also overlap a lot with fibromyalgia. So if you're familiar with fibromyalgia, you might be kind of finding these symptoms kind of go along with that. So, in terms of etiology or causes for what are known causes for chronic fatigue, pretty much any virus that's in the herpes family. So one of the most common and one of the first ones that I really recognized in my practice was Epstein-Barr virus. This is one of the viruses that can cause mono. A lot of times people will present with mono, and they have the severe fatigue, the sore throat that can last for weeks. But a lot of times they feel like they're not recovered within several months. And generally your primary care provider or whoever you see is going to tell you, it's normal, you had mono, you're going to feel bad for a while. But this can just go on for long periods of time. Another virus is cytomegalovirus, human herpes virus 6. So the herpes virus family tends to like to just live in the body long term. So those are very, very well-known causes. Another is a bacteria called Mycoplasma. It commonly causes pneumonia. It's a really kind of difficult bacteria to treat because it doesn't have a cell wall, which is oftentimes where the antibiotics are going to be attacking. Various other viruses, parvovirus, B19, Coxsackie virus, Rocky Mountain spotted fever, you name it. Most of those viruses can cause chronic fatigue. And then there's also, we can't not pay attention to Lyme and co-infections, even though it's kind of a big subject and kind of a scary area to look into, but that's also something that's been documented to cause chronic fatigue. Another thing that they found just with patients who complain of chronic fatigue, they generally have just an immune dysfunction. So if they do blood work, they'll find kind of low immune complexes, low natural killer cell activity and function. That's what NK cell stands for, natural killers. They might have higher interferon and cytokine activity. And then there's generally some endocrine metabolic dysfunction. So this kind of falls under the umbrella of an HPA axis dysfunction. So HPA stands for hypothalamus pituitary adrenal dysfunction. And the hypothalamus and the pituitary kind of coordinate the signaling for your thyroid hormones, your reproductive hormones, and your adrenal hormones. So a lot of times there will be thyroid imbalance, hormone imbalance, and then also kind of stress response imbalance. You can also end up with some blood sugar problems. So through all of that, you end up not feeling very good. And these things need to be looked into and addressed. The other thing that they're finding is that there are several genetic mutations that can predispose somebody to getting chronic fatigue. And those genetic SNPs, or single nucleotide polymorphisms, they found are located in 3 different genes that are connected to the HPA axis. So it all kind of makes sense. You'll find some people who say, I had mono, I was sick for a couple of weeks, and then I was fine, and nothing else ever happened. And then other people who just never get better. Or people who had mono, they were fine for several years, and then something tipped them over the edge, and they end up with chronic fatigue. The other thing that they'll find is there will be some mitochondrial dysfunction. Mitochondria are the part of the cells that produce all of the ATP, or energy. All of our cells need ATP to function properly. And so a lot of times the mitochondria will start to just not function as well, and then your ATP levels won't be as optimal. And then they're also finding just in the gut, the microbiome, the bacteria and the yeast and all of that are present in the GI tract really affect everything here. So we have to look into that as well. So I put a few of the labs that we might look at when we're considering chronic fatigue. The biggest thing is listening to a patient's history, and most commonly there will be some sort of an illness, viral illness, bacterial pneumonia, something like that kind of was the starting point to their condition. And then they'll just say, I just haven't felt as good since then. And usually there will be relapsing or remitting symptoms. So they'll say, I go for a couple of weeks and I'm fine, and then I start to feel bad again. And one of the most common things to find is that cervical lymphadenopathy, people who just have lymph nodes that just don't go away. But normally their blood work will look normal. So a normal blood count, a metabolic panel, lipids, all those kinds of things will be pretty normal. So their doctor says, well, I think you're fine. And conventionally, they will actually treat this usually with antidepressants. They'll use cognitive behavioral therapy, which can be very helpful. And then they'll also use kind of graduated exercise tolerance training, where they'll say, if you can walk for 2 minutes a day, walk for 2 minutes a day, and slowly work your way up. But none of that really addresses the cause, and a lot of times ends up causing other problems in terms of side effects from a medication they're putting you on that's not addressing the problem. So kind of where we as more functional integrative practitioners would go is want to make sure there's a full thyroid workup. Whenever there's chronic inflammation and chronic infection, you end up having the potential of either getting an autoimmune reaction where you'll end up with something like Hashimoto's after you've had this initial viral illness. And then you can also end up with abnormal thyroid conversion because of that inflammation. So we want to make sure we're checking a full thyroid panel, meaning a TSH, free T4, free T3, a reverse T3, and then also thyroid antibodies. We want to look at nutrients as well. So frequently B12 and folate will be nutrient deficiencies that people have. And B12 and folate are very important for normal DNA replication and repair, but also for normal immune system function. Magnesium is another one that's really important that is a very, very easy thing to feel better with. Several research studies found that when you have chronic inflammation and chronic stress on the system, you actually spill out more magnesium. And so hypomagnesemia, or low magnesium, can be very, can help you feel a lot better when you raise those levels. And then also a ferritin. So ferritin is basically your body's stores of iron. And your blood count may not show that you're iron deficient, but oftentimes your ferritin will be quite low. Generally, we're going to want your ferritin to be at least over 60. And a lot of times people are coming in at 7, 8, 9, 16, something like that. And the bottom level of normal for ferritin is 10. So you could be in the normal range, but suboptimal. And that really, you'll feel the effects of having a low ferritin, but it's also a sign of a chronic disease, a chronic illness, chronic infection. We're also going to want to look into adrenal function. So we'll usually do what's called a 4-point cortisol, which is a salivary test, along with a DHEA and a pregnenolone. Those are going to be important for just figuring out if your adrenals are functioning optimally or not. One of my newest favorite tests is called an organic acid test. This test I love because it's a urine test, so it's easy to do on all ages. As long as you can urinate, you can get a sample. And the organic acid test looks at several things. It looks at a number of gut microbiome markers, so it looks at yeast and fungus metabolite products and bacterial products. And then it looks into your neurotransmitters, mitochondrial markers, ketones and fatty acids. It also gives us an idea of your folate and B12 function, as well as vitamin C levels and glutathione markers. So as far as kind of the information that you get for the cost of a test, that's a really good one. We want to look at several inflammatory markers, and there's lots of different ways of looking at those, but an inflammation is something that's going to go along with chronic infection. And then the viral panels. These are things that generally we're going to kind of make the decision on what to look at based on your history. And then also it's always a struggle with insurance because a lot of times those viral panels can be expensive. So that's one thing that usually we'll kind of discuss if it is financially possible to look at those viral panels. It's going to be important because we want to be able to be treating what's at the root cause of this. And then autoimmune markers. This is one that had a patient who had mono, and I want to say it was about a year later that I initially saw her. And her doctors just said, well, you had mono, it's normal to be fatigued. But when I saw her, she had extreme fatigue. She was needing to be on disability, and she also had a really gravelly voice. And so I just, felt her thyroid, that was enlarged. And then we did antibody testing, and she had a new diagnosis of Hashimoto's thyroiditis, which is an autoimmune condition that is very closely linked to especially Epstein-Barr virus. So there's the potential with a chronic infection, because the immune system is just constantly triggered, that it can start to have this imbalance where it will shift towards an autoimmune reactivity. So that's something that I feel like we should always pay attention to, because it may not be the initial cause now. You may be dealing with a new condition on top of it. And this patient was just kind of written off saying, it's the mono, like keep waiting, it's going to get better. But hers was actually an autoimmune condition that's going to be there for a long time, until we can get into remission if we can. Definitely want to check vitamin D. Vitamin D is really important for immune system function and keeping the immune system from going that autoimmune pathway. Blood sugar markers as well. A couple of my favorite ones to look at besides just a fasting glucose is kind of variable, so I don't feel like it's extremely reliable, but oftentimes I'll look into a hemoglobin A1C, an insulin, and a fructosamine, which is a 2 to 3 week average of blood sugars. A really good marker for non-diabetic patients. And then, we generally will kind of go with what we see, what's the most obvious. We kind of start down a certain pathway of testing and see how we do with all of that, see what we find. But then when things just aren't falling into place the way we would like them to be, we will also consider mold and heavy metals, food intolerances, and I should have also written down here Lyme and co-infections. That's just an area that is, I think, very frequently under looked at, and it's difficult to treat. So I think That's a lot of times why people don't want to look into it, because it's kind of, opening a bag of worms when you get the diagnosis of Lyme. And so this is just kind of a general overview of chronic fatigue. I know I probably didn't touch on everything, but I wanted to give just a general rundown of how we kind of look at things, and especially symptoms that you could be dealing with, because a lot of times I feel like people feel like giving up because this just has become their life, and it doesn't have to be. Chronic fatigue is something that really you can get over and be back to your normal functioning self. So I hope that was helpful, and let us know if you have any questions. Have a good one.